Welcome everyone. Welcome to Free Wheelchairs Mission Wheelhouse webinar. This is our second edition, navigating a pandemic and disasters with our partners. We want to thank you all for joining us this morning or afternoon because some of you are in different places. As far as today's program, we are really excited to have you guys. We're going to start with talking a little bit about Free Wheelchair Mission and our mission of what we do, and we'll introduce you to our panelists and hear a little bit about them. And then we'll get into how we've been able to operate and still maintain our operations during this difficult time for so many of us. For those of you who are unfamiliar with Free Wheelchair Mission, we are an organization that is going to be 20 years old next month. So we're really excited about that. We are a humanitarian faith-based nonprofit that focuses on designing and manufacturing cost-efficient wheelchairs. And we serve it to nations around the world that are really suffering and hard to get access to wheelchairs. Now we're able to do this amazing work with our partners that we have on the ground. And to date, we've been able to give over 1 million wheelchairs, and we're so proud of that, to 94 countries that we've been able to serve. So for us, Free Wheelchair Mission, we are proud to give people access to mobility that gives them access to go to work, to go to school, and to do so much. So it's not just access to mobility, but it's really an access to life and a chance at life. So we're really proud to do the work that we do, and we're happy to have you guys. My name is Melat Bagala, and I work in the development team doing helping work with our fundraisers, work with partners, ambassadors, companies to spread awareness about our mission and also to help the space. We have Tess right there, and Tess works on our programs team. She's the regional program manager. So she oversees applications for our program. She helps our partners make sure that their wheelchair program is working efficiently and meeting our requirements. And we've got Nuka Solomon. She is CEO of Free Wheelchair Mission, and she's been with us since 2017. And she obviously operates all of the, from our team to operations. Nuka manages and oversees all of that. Now, before we get into the questions that I have for you ladies, I do have a couple of poll questions for you guys in the audience. So you should see the first poll pop up. And our first question to you guys is, how often have you been on Zoom or video meetings during this pandemic? For me, it's every day, all day. So I'm sure the same for a lot of you. Okay, I'm gonna give you guys about another 10, 15 seconds. Wow. Okay, I'm gonna just end it and share the results. So a majority of you, it's a few times per week and then second is daily and a few times per month. So we're all always on this every day, all day, all the time. So, and I have one more poll question just to ask you guys, and give me a moment. And all right. Our second question for you is, how has your financial support of charities increased, decreased, or stayed about the same during the pandemic? We know that's a hard kind of question because some people, you know, experience quite a bit of hardship, so it's hard to continue to maintain that. Give you guys about another 10 seconds. All right. Let's share these results. So this is quite interesting. So a lot of you had said that you stayed the same and some increased. So that's really, for us as a nonprofit, that's really assuring and good news to hear. Right. I'm gonna go ahead and stop sharing this. So as we're talking today and learning more about how Free Wheelchair Mission has been able to maintain and continue to stay operating, it's really crazy to think that it's been a complete year, 1 year officially since the pandemic has started, and all of our worlds have been turned upside down. So for us to be here today and kind of learn more about the pandemic and how it's impacted us, and we know it's impacted so many of you, I kind of want to start out with my first question to you, Nuka. As CEO, in such a difficult time during this year, how for you has a pandemic had a major impact on your operations? What have been kind of the biggest challenges for you and the team that you guys faced this year, and how have you gotten through it?
Well, thank you everyone for joining us. Thank you, Maylot, for moderating, and Tess for joining me. We couldn't have made it through without you guys on the team, and of course, all of our supporters. I think one of the biggest challenges has been the unknown. I think we've all kind of not known how long this pandemic would last. And as a leader for me and for our team, that's made planning very, very difficult for this year, and trying to balance how do we tighten things up financially against meeting the continued needs of our partners, as Tess, I'm sure, will share more about. Particularly during a medical crisis. You know, when there's a medical crisis like a pandemic, that's when we really need to rise up and do more for our partners because they're counting on us to stay the course. We heard a lot from our partners early on in the pandemic that they were really concerned to see that the United States and Europe were suffering so much, and they feared that they wouldn't be a priority. And we wanted to make sure that they knew that we still were with them. And we try not to be reactionary in our programmatic work. So plans are usually very important and essential. So it was difficult to not be able to plan, but we had to adapt, and adapting and getting through this has meant having very strong and regular communication within our team, with our stakeholders like supporters and partners and vendors, giving them the assurances that we're pushing ahead, that we're moving forward with our work, though sometimes a little bit reduced. And ultimately, the most important was to be transparent about our limitations. I think we all appreciated that open communication. And then last, I would say overarching, like many businesses and organizations, the biggest adaptation that we had to make was a real shift in our budget, and taking a very conservative approach early on, because of the unknown of what the economic strain would be due to COVID.
Yeah. Nuka, I commend you, because it is a difficult job that you have to do and managing all of that. So I really do commend you for all of that. And as you're talking about tests and programs, I'd love to ask you, Tess, the next question. For Free Wheelchair Mission, we have such a unique model of how we distribute our wheelchairs. So I would love it if you can talk a little bit about it, tell our audience a little bit about the role of distribution partners play working with Free Wheelchair Mission.
Absolutely. Hi, everyone. I'm Tess, as Maylot mentioned, and I help manage our partnerships around the world. We are a unique model, so our partners are critical to the way we provide wheelchairs. They are the local experts on the ground. They know the cultural nuances, the context that they're working in. They know the communities. And so they're able to figure out the best ways to reach people, to make sure that they can provide the services that are needed in that place. In a way that we just wouldn't know. We just don't know. And so when we partner with them, they already have established organizations, they have established programming, and they have local staff. And so that allows them to be the sustainable resource for wheelchairs within their communities. And we can come in and partner and provide that supply chain that is not there, that they're not able to get their hands on, which is these mobility aids, these wheelchairs that we design and provide to them. It's a really efficient way, in my point of view, of having this program work. And again, it's really a true partnership, because while we are donating these wheelchairs, they're doing incredible work on the ground to make sure they get to the right people and they get there safely.
Wonderful. Yes. I love our programs. That's my favorite part of Free Wheelchair Mission. It's an incredible program. I do want to ask this, similar to Nuka's question to you, Tess, is what have been the biggest hurdles for your team and our distribution partners that you guys have faced since the pandemic? And how have you and the partners been able to pivot to kind of, respond to the pandemic and all of the challenges?
Yeah, COVID is worldwide, as we all well know now. And so every one of our partners has been impacted in some way. There have been instances where our staff or volunteers at our partners have contracted the virus. In some cases that meant hospitalization. I've only received one report where a staff did pass away, Our partner in Burundi had reported that, and it was someone who didn't work on the wheelchair program, but was part of their greater team. So the emotional toll and the physical toll are very real. You know, it's definitely an impact. They've also are all, you know, nonprofits like us. And so they have struggled financially in some cases. We've had reports where some have had to make layoffs. A good proportion of their staff has had to be laid off, just with the, you know, urgency of other things, reprioritization of the budget, things like that, where fundraising was impacted or the budget was just reorganized. And so they've had to sort of reimagine some of their programming and regroup with fewer staff in those cases. Also, some of our partners have, and by the way, tell me if my audio is okay. I've had some, speaking of navigating the pandemic, I've had some internet challenges, so please stop me if
no, you're good.
But some of our staff partners have also pivoted to some of the more urgent day-to-day needs like food relief in their communities, especially early on with a lot of lockdowns when people can't get to the grocery store or can't get to the market. Others have prioritized the wheelchairs to be used as transport. So working with local hospitals and health clinics to provide the institution with, what I mean by transport wheelchairs is a wheelchair that doesn't go to an end user, but is used within that facility, especially during this time where hospitals are overwhelmed, where they have lots of people and they need extra mobility aids and wheelchairs. And so that has been a huge blessing of this program that we had that supply ready and available for them. I also wanted to just share two pictures. Can you all see this okay?
Yes.
Okay. This is one of our partners in El Salvador. And you can see another way that they've shifted is in the wheelchair provision itself, making sure that they're outside if possible, that they have protective gear. This is one of our staff of our partners providing some user training, letting them know how to use the wheelchair. And you can see he's fully equipped in safety gear. And then this is from our partner in Peru. This gentleman's name is Clever, and he's also providing some user training or conducting an assessment for this gentleman who might be getting a wheelchair that day. And so just new protocols, new policies, new ways of organizing these wheelchair distribution events. Our partners have had to sort of adapt to that new reality.
Right, right. Yeah, that actually makes me think, as you were talking and talk about how many of those nonprofits that we do work with have really suffered a lot during this time. And a lot of people have had to halt their programs because of the virus. What do you think makes Free Wheelchair Mission so unique in the fact that we are still able to deliver those our chairs? And how do you think that it's possible that we're able to still do that and deliver them safely?
Yeah, it's a great question. Our partners are incredibly resilient. There is no question. They, you know, in large part they're humanitarian workers. And so they are familiar with the idea of adapting to new crises or new challenges. And this pandemic in that way was no exception, but the impact of it was quite proportionately, you know, large. And so that has been a challenge. I've kind of mentioned the ways that they've pivoted or adapted. On our end, Free Wheelchair Mission, we made a decision early on during the pandemic. You know, part of our jobs in the programs department is monitoring to make sure that all of the wheelchairs that we donate are going out safely, and so that we train our partners so they can provide them safely. And part of that is monitoring, you know, getting reports back from our partners, conducting programmatic audits from time to time. And during this time, we just put a pause on that. We put a hold on the reporting, we gave extensions, we didn't conduct audits, and we really stepped up into the role of just support. how can we support you? How can we resource you? It really was an emergency. And so we wanted to make sure we were there to provide resources and support and not have them worried about a report, when things were
Right.
so intense. And so luckily we've had online training modules. We've had remote training that we had established previously. We had piloted previously. And so we had those in place ready for our partners. The online training modules are almost ready. We did pilot them already, but we've had a virtual remote training ready to go. And so we utilized that. We also had a webinar, much like this one, on safe wheelchair provision during COVID-19. So we had resources and documents and handouts translated into 16 languages so that our partners could, hopefully utilize that within their programming.
Oh, that's great. Yeah. Even hearing just how the programs team has been so prepared even before the pandemic for a lot of these things is so good to hear. Nuka, I guess that would kind of pivot my question to you. Similar to our programs team, how do you think yourself and Free Wheelchair Mission took steps early in the pandemic that have really helped you guys stay ahead of the curve?
A good question. I think it's a question that a lot of different organizations and businesses have learned from through this unprecedented time. Thankfully, I feel pretty good about the fact that we had a lot of things in place or I should say, even before the lockdowns were required here in the States. We actually locked down a few days or more before the state required for us to do so, or our county required for us to do so. So that put us a little bit ahead of the game. I remember a few people kind of questioning our decision to do that, and it ended up that everyone ended up having to do that. But that allowed, being ahead of the game allowed for us to be prepared from a technology perspective, because as you said in the poll, we're so dependent on technology this last year. Even more than before. And that was critical for internal team communication and to maintain our communication with our partners. So being able to do that in advance and to get a leg up with the IT team and get all the laptops in place before there was a run on laptops the week later was key. And I feel very good about that. I also feel good about something very silly, another one of your poll questions. Was Zoom, and our team has been using Zoom for years. And so Zoom was not new for us. I mean, sure, we had to buy a few more accounts, but we were very familiar with the tool. It was an essential part of our team meetings and sometimes even our communications with partners. So that wasn't out of the ordinary. And then I would also say we were prepared because our programs team has been mindful, because we can't always fly everywhere and we're trying to manage our costs, to prepare with online trainings. And so we had a whole online training curriculum that had already been drafted by an expert in our team. And we were really blessed to be able to implement that and use that during this pandemic, because virtual training has been what we've really depended on in this time when we haven't been able to travel. For those of you that are familiar with our program, the training program is essential. It is a very critical part of maintaining the integrity of appropriate wheelchair provision and safety for the end user. We value so much showing them our love and showing them the meaning and the value of why they deserve the wheelchair. But we can't also ignore the reality that we're giving them a medical device and we have to do it safely. And then I would say we were prepared in a way because we have such close relationships in Asia. And they were actually, as we all know, ahead of the game in terms of, unfortunately, suffering from COVID. And so we knew months before that there was a potential for all this to happen. So we were already having discussions. So in a lot of ways, I feel like we were prepared. Yes, there were some unexpected challenges, but we had certain things in place that have allowed us to continue to operate.
Great, great. Thank you, Nuka. I want to kind of change it and pivot back to our wheelchair users. So Tess, I have a question for you. For those living in these developing nations with disabilities, so often are really the most vulnerable individuals to facing this emergency and pandemic. Can you talk a little bit about the challenges that they have faced with these emergencies?
Absolutely. And I know that I think we might have some partners on the call, actually on the webinar, and I'm sure they can speak to it as well. You know, some basic things are become an incredible challenge when it comes to even things like hygiene. So some people with disabilities may not be able to physically wash their hands on their own, you know, which is one of the key things of keeping yourself safe. And in some cases, you know, maintaining social distancing can be a challenge because they rely on a caretaker, or they rely on the staff at the hospital they're going to help them, or you know, the staff at the grocery store to help them. And so some basic things aren't really realistic for the day-to-day person. There's also, you know, in some cases they might have underlying health conditions, which means that if they do contract COVID-19, the case might be more severe, and the symptoms might be greater, and they're at greater risk. And so, you know, all that adds up to being more vulnerable during a pandemic like this. And so when lockdowns happen, they have less access to get places. Their caretaker may be preoccupied with, you know, day-to-day things and may not be able to give them the level of care that they normally would. So there's certainly just more barriers to public health information, more barriers to not contracting the virus. So yeah, and these are the people that we're hoping to get mobility and get a wheelchair to keep them a little bit safer when times like this happen.
Right. So from what the impact has on the pandemic has had on the need for mobility in these communities we serve, have you seen an increase for the need of mobility? I mean, what have you heard from the ground and from our partners?
Yeah, from my perspective, there's a massive need. So that's been established, right? The WHO says 75 million people need a wheelchair and cannot access one, cannot afford one. That massive need has really stayed the same. So that's still a constant massive need. What I've seen is that when a pandemic happens like this, the need maybe remains the same, but the barriers to getting a wheelchair now become greater because of for the public safety, there are lockdowns, but then that means they can't go pick up their wheelchair. That also means that they can't, you know, the people that might need a wheelchair might also have regular doctor's appointments or regular physical therapy. And when there's things like lockdowns, they can't access that same level of healthcare. And so, and like I was kind of explaining, our partners might pivot to more, you know, prioritizing food, day-to-day just food. You have to start to prioritize things instead of wheelchairs. And that means that people have less access to those wheelchairs. And so, so I've seen that. And there also has been, I think, a greater increase in the need for those transport wheelchairs. So within medical institutions, just because of the way this virus has taken hold.
Wow, yeah, that's the heartbreaking part about all of this. Of course, all of us are, you know, having different inconveniences, but that is another kind of inconvenience and just a different kind of struggle. So thank you for that, Tess. Nuka, I'd like to hear a little bit from you. What were some of the unexpected challenges this pandemic had on the programs and operations for you as CEO and operating us Free Wheelchair Mission staff and continuing to do the work?
From a programmatic perspective, I think it's something we've started to notice about 6 months ago, give or take. We started noticing some increases in the price of shipping. For those of you that may not be familiar, we ship our wheelchairs in container loads, and they go directly to the port city closest to our partner, wherever they ask. And we rely very much on those ships and getting those wheelchairs out. And there's been an increase. And the increase started about around that time. And in the last couple of months, it's just been astronomical. And that means that there's some significant implications for us as an organization in terms of our ability to get out as many wheelchairs, and potentially for our partners too, right, in terms of the timing and of when they can receive. So it's something that is not finished. It's something we're actually very much in the middle of, in the thick of, as I call it. And there could be a very significant long-term impact, given that experts are saying that these increased shipping prices that we're seeing globally could last for a year plus. So in terms of planning, in terms of budgeting, and in terms of wheelchair distribution, the nuts and bolts of it, it's going to be difficult. And that's just a real thing. I know that some people have asked, well, can you just shift which countries you send them to? And maybe you just don't send them right now and you send them later. Well, we have contractual obligations that require for us to ship out a certain amount of wheelchairs at a time. We also, as I said earlier on this webinar, have to be mindful that during a pandemic, as Tess said, the barriers to getting a wheelchair, the need for wheelchairs is not a time really for us to stop giving out wheelchairs to our partners who are in the humanitarian relief work. From an ethical standpoint, that would be very difficult for us to swallow. And I think from a training and programmatic training perspective, if we do not maintain a steady flow of wheelchairs, even if at least we could reduce, and we have for budgetary reasons, then there are long-term implications in terms of our ability to maintain that partnership, which we've invested so much in, and have maintained a trust with these organizations. If we halt that, we will end up in years to come having a lot of problems. And I think the other big challenge has been the cost of raw materials that our manufacturer has already identified and told us, due to economic changes during the pandemic, has increased significantly. And despite our best efforts, which we continue to have, to source additional manufacturing sources, which, that was actually before COVID. The reality is globally, raw material prices that are aligned with how we make our wheelchairs are increasing. And so we are very mindful that we will have to address that this year. And that will likely mean that we will have to announce an increase to the price of our chairs. But our commitment and our hope always is to maintain that price at a reasonable level, and for our supporters to continue to trust us that we're using their donation dollars wisely, and that we're trying to, in our wheelchair design, maintain costs judiciously. So that's the unfortunate reality of COVID. As much as I said we were prepared, these are the things that we didn't expect, and we're still contending with.
Right. Yeah, a lot of those things, like you said, is hitting many industries and across the board. So we are not unique or different from that. So before I get into a few more questions, I do want to remind the audience, please go ahead, and if you want, if you have any questions, there's a Q&A option at the very bottom of the screen. So please go ahead and write some questions. We will get to it at the end. So if you can, go ahead and write those questions in there. So I know we've been talking about all the challenges and things, but I know there's been some good news for us. This past year, we were able to add another country to serve. So congratulations to Tess and the programs team, bringing that to 94 countries, which is a big accomplishment. They worked really hard, and so we're really proud of that. Can you tell us a little bit about where, I know you work in a lot of the regions, but where are some of the countries who were hit hardest and impacted the most this past year?
Yeah, thank you. Yeah, we're very excited and proud. We added Yemen, which is a new country for us in the last 20 years as we've been an organization, and the need there is quite incredible. So we're proud of that. It's pretty difficult to rank where COVID maybe hit the hardest, quote unquote. We have partners like Vietnam, and they, during the very beginning of the outbreak, they were very, strict and diligent about the way they locked down. And so actually they've been virtually COVID free for the last, set of months. And so they've been able to operate somewhat normally and travel and provide wheelchairs. And then we have partners that have gone through many lockdowns and many new policies and protocols. Many of our partners, I will say, work with multiple layers of crises at one time, right? So Honduras, for example, in the recent months have had massive storms and flooding, and people have lost their homes. And that's not necessarily unique. We see a lot of these natural disasters and other crises that sort of compound with the COVID pandemic to make things more challenging, to have a greater impact on our partners that are working in those contexts. Uganda and Nepal are some examples where the lockdowns were also very strict at some points during this pandemic. And because of that, actually, they had some negative impacts of, getting access to food and getting access to healthcare services and appointments for the people that they serve and work with. And so, the balance of public safety and access to food and all that becomes very complex and very difficult for our partners working to provide wheelchairs and working within COVID-19. So, all of our partners were impacted by COVID-19, and all of them have had to adapt in their own ways.
Right. Right. So so you mentioned some of the challenges the community is facing during the emergencies and the pandemic. I also know it turns out that Free Wheelchair Mission provides some other forms of other things outside of wheelchairs that come in handy during the pandemic. So I'd love it if you could tell us a little bit more about speaking into the medical supplies and mobility aids.
Yeah, we do. We began a program which is known as Mobility Beyond Wheelchairs, probably about 5 years ago or so, to complement our wheelchair program. And what this is so for our wheelchairs, we design them and manufacture them ourselves with our partner factory. But with this program, we procure the items, the medical goods, with organizations here in the United States that receive donated medical supplies, bulk medical equipment from manufacturers. They purchase items at a discount. So they have these inventories of medical goods that we procure for them for our partners. And so our partners that work on this program are either hospitals themselves or have close ties with medical facilities. And so they send us their needs list. What do they need? What equipment? What supplies? What vitamins, things like that. And then we work with our procurement partners to build out a container, a shipment of what they need to send to them. And because of that, we have had partners that we shipped them PPE pre-COVID, for example, probably a few months before COVID hit. And because of that, they had this valuable good that they were able to utilize, which really impacted, how their healthcare systems reacted to the virus. And so it's been invaluable to our partners to have this source of medical equipment and supplies so that when crises happen, they have what they need. They have supplies already in store.
Right. And I do want to add that because that program's team has done is amazing. And it was highlighted too in CNN and in Washington Post as organizations who are helping fight COVID. So I think that's a pretty great thing to be noticed for. So I just want to bring that to your attention too and mention that. And Nuka, I do have my last question for you, which is we talked a lot about the challenges that you faced and the team has faced this year, but we do know that there's been some silver linings. So in the past year with our team and our partners. So I'd love it if you could talk about that.
Oh, wow. There have been lots of silver linings. So I don't think you have enough time because I always try to find the positive, even in the midst of a storm. The team knows that. I would say the first one, and not in any order of priority or importance, has been that we were pushed to be creative You've used the word so many times. A lot of people have used the word so many times, the word pivot. And Free Wheelchair Mission is known for and founded on its innovative spirit, based upon how Don started the organization. And our team's creativity is what has allowed us to quickly pivot during COVID, despite the unpredictability of COVID. We've been able to broaden our reach to more audiences because we were forced to do virtual events and have a greater online presence. And that benefits our program because then it elevates the need and of the mission to more audiences, not just the United States, but globally. And I think the biggest highlight of that was our signature fundraising event that we do every year in July, Miracle of Mobility, where in 2020, we were able to reach all 50 states and a few countries around the globe with that event, and tens of thousands of people watched that event, as opposed to before COVID, when we had maybe just 500 or 600 people at the event. So from a silver lining perspective, I think that's actually a gold lining, because our goal is always for more people to know about us, because we want to elevate the need, which Tess talked about, the 75 million people that need wheelchairs. And, you know, being virtual also allows for us to magnify the importance of the user, that they shouldn't be forgotten, that they have important stories. So every time we reach more people, that means that they then potentially could be on our e-blast list, and they could potentially then hear the stories of individuals that we share who are the end user every Friday. So that's a big one. I would say another one is what Tess mentioned about our Mobility Beyond Wheelchairs program that we were able to highlight, because everybody in the world was talking about personal protective equipment and medical supplies. And we didn't miss a beat there. And actually, we've exceeded last year's medical supplies donations to our partners. So that's huge. And so being able to elevate that need and to highlight that need during COVID, I think is truly a silver lining, though it's not the mainstay of our program. And then I would say maybe the last and probably the most important is communication and resiliency. Our partners have been resilient. We've always known them to be resilient, but we've been put to the test as an organization about how resilient we could be. And I think we've so far fared very, very well. And I think the communication part is how we've been able to demonstrate our resiliency. The communication that I mentioned earlier with our partners has been critical. I mean, could you imagine, we're not able to travel to them, and if we weren't able to communicate on forums like Zoom or WhatsApp or by email, there's a real disconnect then in terms of what we're trying to maintain. Same for our supporters, being able to check in on them and let them know how we're doing. And that is critical for maintaining the need for our budget to be maintained and for our overall mission to be maintained. So I think those are the silver linings. And technically, we're not done with this pandemic. So hopefully we'll continue to maintain our resiliency and communication with all.
Yes, actually, Nuka, that sparked another question, and I saw somebody had sent a message about it too. Do you think travel for our supporters or staff will return anytime soon?
Yeah, it's actually something that we just talked about. I had a meeting with our head of the programs department and the associate director of that department. And we've been talking to our peers. So other nonprofit organizations like World Vision, for example. And the consensus with organizations like theirs and ours is that travel needs to be halted until at least January of 2022. And that is because, first and foremost, from a vaccine administrative perspective, we may be getting the vaccine here and broadly may be given to our citizens, but globally they're behind us. And we have to be mindful that the people that are getting the wheelchairs are typically high-risk individuals from a health perspective. So we have to, you know, kind of manage the reality from a medical perspective that it may not be safe for us to do these flights, as well the travel restrictions that are in place in some of these countries may not be in our best interest from a budget standpoint. it's not necessarily the best use of our money to have a team member be quarantined for 14 days in a country. So those are the types of things we're balancing. And last, I would say, our partners aren't really in a position to receive us right now. They've got their hands full, as Tess explained, and they've made it clear that they have other priorities. It's not to say that the wheelchair program is not a big priority for them, but in terms of hosting us and rolling out the red carpet for us, as they always do, it's just not the priority during a pandemic for us to travel in that way. So for now, we're seeing that our team will travel hopefully in January, and it'll be determined at that time if that will be if we'll go forward or we'll have to extend that deadline. But it's pretty much the industry standard with other organizations like ours.
Right. I know I can't wait till we can travel again. I miss being able to touch the work. And I know for a lot of our supporters and everybody, we want to get back to that. So of course, we understand, but definitely miss being able to do the work and touch it. Before I get into my next question, I just want to make another reminder, please send questions in the Q&A box. So if you have any questions for Tess, Nuka, or myself, please go ahead and post it in there. I do have a question first for you, Nuka, and then Tess. For the coming months that we have for Free Wheelchair Mission, what are some of the main priorities you have coming up for the next few months?
Oh, wow. Well, as you mentioned, we have our 20th anniversary, which is next month on April 20th, and we're going to have a webinar, just similar format to this, but even better because Don will be there with me, and Bob Shank will be moderating. And our priority is to share with all of you, as I said, transparency, what we're projecting for the future, and actually also take a look back at the past. So we're planning that and planning all the other events and programs that we put forth to communicate about our mission. So besides these webinars, we have our Move for Mobility. That's going to be the entire month of May, which is a major fundraising initiative for us. We're also planning our Miracle of Mobility already. That's going to be in July. And we have continual projects that are year-round. We have a quarterly newsletter where we specifically communicate about our partners' work, and we focus in on one country at a time. So the one that we did in the winter was focused on the Philippines. And so we'll have another one in the spring. So those are the main, I would say, organizational projects. And then, we're continuing to source another manufacturer to add to the one we've had a relationship with. But I'll let Tess share on her end if there's anything from a program's perspective that the team is specifically working on that she wants to share with the audience.
Yeah, we continue to provide trainings to our partners on wheelchair assembly and safe wheelchair provision. We just had one in Haiti with a new partner there, and our wonderful Haitian American CEO stepped in for a little guest spot on that training, actually. We have one coming up in Iraq that we'll be doing. And we're also launching our final version of our online training modules, which I alluded to a little earlier, and so did Nuka, that we piloted last year and have been very hard at work. One of our team members, Nicole in particular, on developing and putting into practice for our partners to utilize. And it'll be in Arabic, English, and Spanish on this initial run, and we hope to get it in more languages soon. And then we're also preparing for our next fiscal year, which begins in July. And so part of that is collecting our requests from the field. How many shipments do you need? What wheelchairs do you need? Tell us so that we can plot out our order schedule for the upcoming fiscal year. So that's some of the things we have coming up on the program's end.
Great. Tess, there was someone who asked, when are we going to start shipping chairs again? So I do want you to clarify about the shipment and when we did stop and why and how we've continued.
Yeah, we are shipping wheelchairs. I think maybe Nuka mentioned we had to halt for about maybe a month when the pandemic really began in March, when our factory was closed. But we are continuing. We have not stopped shipping wheelchairs. So our partners are still requesting them, needing them, and we are still providing them.
Wonderful, thank you.
And I'm sorry, and Nicole jumped on the chat here. I think she's joining us. There was a training in India as well, a remote Zoom training that happened.
Oh, perfect. Yes, thank you, Nicole. I have one more question for you. Even as we are currently now emerging from the pandemic, as you mentioned, Tess, there still are often disasters that happen within these communities that we do serve. So what are some of the things that this pandemic has helped us and our partners do to be prepared for other disasters like this, like the pandemic?
I mean, it's really just fortified the need that we've identified for virtual resources. We cannot travel to an active war zone for our own staff safety. So when we work in places like Yemen, that's a big barrier. And so making sure we have virtual resources that are really useful. Many people on this call maybe have taken an online course or participated in a webinar like this, and we want to make them engaging. We want to make sure they're being utilized correctly. The knowledge is really, being absorbed. And so it's really just putting more investment and time to ensure those tools that we develop are as useful and engaging as they possibly can be, because in person will just not be realistic for a lot of for crises like this, for example.
Right. Okay. We just had another question come in. It says, I thought the 2020 Free Wheelchair Mission annual report was excellent, particularly the photos quality. Given the challenges of the pandemic and its economic impact, will you provide the same format and quality of annual reports that you did in 2020? So Nuka, I would say this question.
Thank you for the compliment. The team knows that's one of my big projects for the year that I ask our wonderful marketing team to do extremely well. And the reason is because we're very mindful that not only can we not go to these places, but our supporters cannot go to these places. And that's even before COVID. Not every supporter can get to every location. And so showing in pictures what we're doing is very impactful and meaningful. And also demonstrating and showing that we are very transparent in our financials and how we deliver our program from start to finish, I think is really, really important as well. So yes, we will plan to do another annual report next year. We usually publish it around January or so, end of January. We start working on it at the close of the prior calendar year. So it is in our plans to do. We've put it in our budget, and I think we look at it as, at least I do, as equally important as doing our taxes or doing the 990 or filling out a payroll form. That annual report is a document that is very important in our relationship with our supporters and then also our partners, for them to see what their peers are doing and the extent of the impact that the work is having. And it also, lastly, I would say, shows a little bit of the story and the beauty of the end user.
Right. And Nuka, I also got a question sent to me, similar to the question that I asked Tess. Has this raised awareness here in the US for countries we served? So has the pandemic in any way changed?
Yeah. I don't think so. I have to be honest about that. And I think it's because the reality is the United States suffered quite a bit with COVID. And we were magnified as the country with, with the biggest numbers. And we've had a lot of other things going on in the country besides the pandemic in this last year. So I think I wouldn't say that COVID specifically has elevated the needs globally for wheelchairs. But what it's done for us is it's, as you saw from the poll. I wasn't actually really surprised by the results of what people said in terms of them giving back.
Right.
What it has elevated is the need for people to think of others. And so I think in times like this, you realize that there's a lot to be grateful for. And that gratitude extends to many things. So if somebody comes upon Free Wheelchair Mission, then they then think about it a little bit differently than maybe they would have pre-COVID. So that's the best way I can answer that.
Right. Okay. That's great, Nuka. No, I completely in agreement with you on that. So if there's no more questions or anything else, Nuka and Tess, would you like to say any last words before I close this out?
Tess, I'll give you the floor and then I'll.
Just thank you all for joining. I hope we were able to, our experience as an organization has, helped in some way, or at least brought some solidarity to the situation among nonprofits and companies alike here in the US, but also abroad. I think maybe some of our partners, distribution partners, are on the webinar. So thank you so much to you all. I said at the beginning, I'll say it again, our partners really are the critical piece of this work. We are the supplier and the sort of support and equip, and we have a great partnership with them that makes this wheelchair program possible. And so thank you all for joining. Yeah.
Thank you, Tess, for your words and for doing this with me and Melat today. And I want to thank what I call kind of the 4 prongs of Free Wheelchair Mission. Our partners, as Tess mentioned, the end users, of course, that we serve, our supporters, and also our team, because without our team, we really can't do this work. It's really important for me to be able to resource the team and maintain the organization so that we can then serve the supporters, the partners, and the end users. So thank you all for your hard work and your resiliency and creativity throughout this tough year.
So I'm gonna, before I end it out, I do have one more survey for you guys to take. But before I do that, I just want to thank Tess and Nuka for your insights. It has not been an easy year, but you two have been resilient and have been great leaders in your Tess for programs, and Nuka as a CEO. So you guys have really helped me continue to help to do the work and fundraise for it. So I just want to say thank you on behalf of me and the entire team for just all the work that you guys do. Thank you to everyone who has been on this. We appreciate you coming to this and learning more about Free Wheelchair Mission and how we've been able to maintain during such a unique time. We do ask that this is recorded again, so you guys please go ahead and share it. We'd love it if you could attend our future webinars, get on our Friday email listserv. I mean, there's so many ways to engage with us, so we hope that you can continue to engage with Free Wheelchair Mission, and we are really honored and grateful to have you guys today. So we're gonna end it out with this last poll, and we hope to see you guys soon. Thank you so much. Let me just pull it up, one moment. And here you go. So there's a lot of ways to engage with us. We hope you find something today that has interest, our Move for Mobility, our Miracle. There's a lot of ways from your organization and company that you work at to engage with us. So you can go ahead and contact us at info@freewheelchairmission.org. Our website, our social medias, please follow us on all of them. We'd greatly appreciate that. So I'm going to end this poll. Thank you all so much. We appreciate you being here today. And we just want to thank you guys. Bye.
Bye. Thank you.
Bye, everyone.